Chapter 16 is covering the lymphatic system and the lymphoid tissue. The lymphatic system is a widespread web system of tissues and vessels. While its organs are not exactly grouped together, they are scattered throughout the body. In order to service all the regions of our body, they are interconnected with each other through the lymphatic vessels. The overview of this lecture will cover the lymphatic system functions, the lymphatic circulation, describing the lymphatic capillaries, lymphatic vessels, and lymph movement. The lymphoid tissue, including lymph nodes, spleen, thymus, and the structure that is called MALT, and also the disorders of the lymphatic system. Please take a moment and pause this presentation in order to review the learning objectives. We'll start by defining the functions of the lymphatic system, and the function will vary based on the location of the lymphatic structure. However, they can be classified as inside three categories, and those will be the fluid balance, the protection, and the absorption of fats. In the category of fluid balance, and you see here, we'll have an image that we used before to understand the hydrostatic and the oncotic pressure in the capillaries in the previous chapter. So we are going back to that concept, the fact that the blood will circulate through the capillaries and the water and the dissolved substances, electrolytes, hormone, nutrients will be in a constant exchange between the bloodstream and the interstitial fluid. However, in order to prevent this type of fluid accumulation, while a certain amount of volume will leave the bloodstream, the capillaries, a similar or almost similar amount of volume will need to return to the capillaries. At the venule end of the capillaries, where the capillaries start to become venules, there will be in the interstitial tissue a certain amount of extra fluid that will accumulate at what is called the distal end. And this extra volume will be returned to the bloodstream through the lymphatic vessels. Also, the proteins that leak out of the capillaries will be returned to the circulation by being reabsorbed inside the lymphatic system instead of lingering around in the interstitial fluid. So at any point in our body, everywhere in our tissue, will have those microscopic lymphatic capillaries that will pick up the excess fluid and the proteins and will return them to the main bloodstream. The fluid that will circulate in the lymphatic system is called lymph, which is a clear to milky type of fluid depending on where it is situated. In the tissues in the periphery, it looks like a clear fluid, almost similar to the interstitial fluid. So it will be made out of blood plasma combined and other proteins combined with water. The second function of the lymphatic system is the function of protection. And the lymphatic system is one of the main components of the immune system. And the immune system, as you know by now, is that part of our body that will fight infection and will try to prevent development of cancer. One of the white blood cells existent in our bloodstream, the one that is called the lymphocyte, its house, the place where they live and multiply, is in the lymphatic system. They will mature. They will develop into inside the red blood marrow and will migrate in the periphery, and they will populate the lymphatic tissue and will continue their process of maturation and development in those periphery lymphatic structures. The third type of function of the lymphatic system is the absorption of fats, and that happens at the level of the large bowel, where the digestive fats are a little bit too large in terms of particles. Their molecule is too large to be absorbed inside the blood capillaries. they are eliminated in the interstitial fluid, and they will stay over there until a capillary, a lymphatic capillary, which in terms of structure, you will see immediately why they are able to do that. The gaps between the cells in a lymphatic capillary are larger than those in the blood capillaries. So the fat molecules that are big molecules will be able to be absorbed in the lymphatics. So the fats will be absorbed into what is called the lacteals. Those are the lymphatic capillaries in the small bowel, and will be transported through the lymphatic vessels until they will open inside the main bloodstream. And at this level, because of the high concentration of fats, the lymph will have this kind of milky type of aspect. Just like we described the lymphatic, the cardiovascular circulation, we'll describe now the lymphatic circulation, and it's in some ways it is similar, in some way is different than the systemic or pulmonary circulation. So the lymph will travel through this widespread network of small capillaries that will become larger, will branch in and will become larger and larger channels, and they because they look like blood vessels, they are kind of similar with the blood vessels. However, this circuit, it differs from the cardio pulmonary one because it's not a complete one. It's not a circle. The lymph will not gonna circle inside this kind of closed system. Rather, it will be made out. It will start at the level of the tissues, and the fluids will be returned to the mainstream. We'll describe now the lymphatic capillaries. So lymphatic capillaries will collect the fluids from the interstitial space, and their wall resembles the one of the blood capillaries, with the difference that the cells that are disposed in one layer, they are flat and have gaps between them that are larger than those from the blood vessels. So in other words, the wall of the lymphatic vessels is a little bit more permeable than that from the blood capillaries. This quality is described as a lignous capability, and the lignous capability facilitates the entry of water and large molecules as the fat molecules, but some proteins can be also larger. So the interstitial fluid or the extra interstitial fluid will enter the lymphatic capillaries using those gaps through the mechanism of bulk flow, because the pressure in the interstitial fluid is higher than the pressure at the level of the lymphatic vessels. As a result of accumulating, the build-up pressure inside the vessels will push the fluids into the bigger and bigger vessels, and will ensure the flow through the capillary vessels. So one difference that we can describe between the lymphatic capillaries and blood vessel capillaries is that they are what is called rising blindly. They are closed. They look like a digit, and they are not a continuous system, a continuous connection between vessels. So I'm trying to summarize again the way that the lymphatic capillaries will perform in order to maintain the fluid balance. Whenever there is an increased interstitial fluid volume, as a result of that, as a result of accumulation of fluids and particles, either proteins or fats, there will be an increase in the interstitial fluid pressure. So the increased pressure gradient, which is the difference between the pressure in the interstitial fluid and the pressure inside the lymphatic capillaries. And inside the lymphatic capillaries, at the blind end of it, the pressure will be almost zero. So the increased pressure gradient between those two areas will generate an increased shift of fluid from the interstitial space inside the lymphatic vessels. And as a result of that, the pressure in the interstitial fluid will decrease, being gained now by the inside of the lymphatic vessels. And as a result of that, the interstitial fluid volume returns to normal. We'll continue by discussing the vessels and the nodes, the node lymphs, the structures that make up the lymphatic system. And as I said before, the lymphatic vessels are those thin-walled, very delicate structures that seem to have a beaded appearance because they have certain indentation along the way of the vessel in the places where the valves are located. The valves are located inside the lumen, inside the cavity. And those valves, if you remember, we described a similar type of valve in the peripheral veins, will prevent the backflow of the lymph. We have a set of superficial lymphatic vessels, and we also have a deep system of lymphatic vessels. Those that are superficial will be located immediately under the skin, and they are usually in very close proximity of the superficial veins. The deep vessels are usually a little bit larger and will run along the deep venous system. The name of the lymphatic vessels corresponds to the location on the body. For example, for the breast area, we'll call them mammary lymphatic vessels. For those in the area of the thigh, they will be called femoral lymphatic vessels. Along the system of lymphatic vessels, we'll have some areas of drainage that are called lymph nodes, kind of an intermediate stations, that are small masses of lymphoid tissue that act as filters for the lymph. Usually those nodes are placed in groups and they perform a service. They will drain a certain region of the body. Most of the lymphatic vessels will carry lymph away from the regional nodes into more central areas, and eventually will drain into one of the two terminal vessels. And the terminal vessels will be the right lymphatic duct and the thoracic duct. And both of those will eventually empty inside the bloodstream close to the heart. And I will describe both of them in a little bit more detail. We have the right lymphatic duct, which is a short vessel, not longer than about ½ an inch, that receives only the lymph that comes from the superior right quadrant of the body. That means the right side of the head, the right side of the neck, right side of the thorax, and right upper extremity. This very short duct will empty inside the right subclavian vein close to the heart. And at the level of the opening of this vessel, there are two pocket-like semilunar valves that prevent the blood from backflowing inside the duct. This duct has a pressure, has a lower pressure than the pressure that we'll have inside the veins. And that's the point for having those valves, to prevent the backflow of blood inside the lymphatic structures. We have another structure that is called the thoracic duct, or the left lymphatic duct, which is way larger, and it's in length about 16 inches, 40 centimeters. And this duct will drain the lymph from all parts of the body except for those superior to the diaphragm on the right side that I described before and that are drained by the right lymphatic duct. The thoracic duct will drain itself, will end at the level of the left subclavian vein. This duct will have an enlargement in its first part that is called the cistern, or a temporary, it acts like a temporary storage sac or pouch. And this cistern is called cisterna chyli. The chyle is the milky fluid that will be absorbed through the lacteals in the small intestine, and is made out by a combination of fat and normal lymph. The chyle passes through the intestinal lymphatic vessels and the lymph nodes of the mesentery, that's the membrane that surrounds the intestine. We didn't reach that part. We didn't describe yet the anatomy of the digestive system. And finally, the lymph will enter the cisterna chyli. In addition to the chyle, all the lymph from below the diaphragm will empty also in the cisterna chyli and subsequently in the thoracic duct. As you can imagine by now, there is a certain way that the lymph, the fluid part of the lymphatic system, is moving inside the lymph vessels. And the movement of the lymph toward the heart is encouraged or supported, first of all, by some contractions that are rhythmical and that are contractions of the lymphatic vessel that will propel the lymph forward. The contraction rate depends on the amount of fluid that exists at that point in time inside the vessel. The more fluid being inside the vessel, the more rapid the contractions will be. In addition to that, those mechanisms that were helping the venous blood to return to the heart will also help in the movement of the lymph. And those systems were the skeletal muscle contractions that will put pressure and will encourage and promote the contraction of the lymph vessels and also push the lymph forward, will be the valves in the lymphatic vessels that will prevent the backflow of the lymph, and the breathing movements that will create a negative pressure inside the chest, and by doing that will suck in the lymph, the fluids inside the lymphatic vessels. Question number 1. Which of the following is not characteristic of lymphatic vessels? And the options are A, they have thin walls, B, they are blind-ended, C, they can contract to propel lymph, or D, they transport lymph to the tissues. And the answer is the one statement that is not a characteristic of the lymphatic vessels is D. They transport lymph to the tissues. The transportation of lymph is away from the tissues towards the heart. We'll describe now the lymphatic structures that are part of the lymphatic system. The lymphoid tissue, how it is named, will be distributed throughout the body, and it's located in some specialized organs. We'll start by describing the lymph nodes. So I just said that the lymph nodes should be seen as filters for the lymph, while the lymph is traveling through the lymphatic vessels. They are those sites where lymphocytes, those special type of white blood cells, will multiply and will develop their capability to combat foreign organisms, any type of particle that is perceived by the body as foreign. Those lymph nodes usually are small and rounded masses. They may vary in size from a pinhead size to up to an inch. They are still normal if they are 1 inch big. They have on the outside a fibrous connective tissue capsule, and this capsule will send inside trabeculae or septums, kind of walls separating the node tissue. At various points on the node's surface, the node will receive incoming afferent, AFF, afferent lymphatic vessels. Remember, from the nervous system coming in, everything that is received by structure will be called afferent with an A. And those will penetrate the capsule and will enter the lymphoid tissue, carrying the lymph inside some open channels inside the node that are called sinuses. Pretty much on the opposite pole from the area where the afferent lymphatic vessels show up and enter the node, will have an indented area that is called the hilum. The hilum is the exit point for efferent lymphatic vessels, and those will be those vessels that are carrying lymph out of the node. Also at this location, we'll have some other structures that are supporting the lymph nodes. Those will be the tiny blood vessels and nerves that are supporting this structure. When we are looking inside to the structure of the lymph node, we can divide this into two parts. We have an outside part that is called the cortex, and we have an inside part that we'll call the medulla. Each of those areas will have also the lymph-filled sinuses and cords. At the level of the cortex, the structure will be described as cortical nodules, each of them having a germinal center. And you can see it in the picture if you follow my explanation on the picture. So on the cortex, we'll have the cortical nodules that in the center will have the germinal center. On the outside, they have the cortical sinus. And in the medulla, you'll find the population of immune cells, the lymphocytes and macrophage, that are lined along the medullary sinuses. So we have cortical sinuses and medullary sinuses. As I said before, the lymph nodes are not isolated, and they come in small groups. They can come from 2, 3 to, in some cases, over 100. Some of those groups will be superficial, and some of them will be deep inside the tissues. And I can mention a few of them. We have the cervical nodes, that they are located along the neck. They have both, in the neck, we have both deep and superficial groups that they are draining various parts of the head, face, and the neck. The most common cause for enlargement of those nodes, a benign condition, will be in the case of upper respiratory infections, and usually are very easy to observe and feel when we examine someone in children. The next station will be the axillary nodes. They are located in the axilla or the armpits, and they become enlarged during infection of the upper extremity or infections of the breast. Also, cancerous cells from the breast metastasis may spread to the axillary nodes. The next big station will be the tracheobronchial one. Those nodes are found near the trachea and around the larger bronchial tubes, especially in those people that are smoking, exposed to smoke or polluted areas, as well in those that have lung cancer. Those nodes may become enlarged. Mesenteric nodes is a wide and really well-developed group of nodes. They can be up to 150, and they are placed in the two layers of the peritoneum. That's the membrane that covers the bowel and forms the mesentery. When we are moving down, we have the inguinal nodes located in the groin area that receive the lymph drainage from the lower extremity and the reproductive, external reproductive organs. Spleen is the next lymphatic organ that we are going to describe today, and the main function of the spleen is to filter the blood. And in a similar way to the lymph nodes, the spleen will filter part of the lymph also. The spleen is located in the superior left hypochondrium. It's high up under the dome of the diaphragm and normally is protected by the lower part of the rib cage. That makes it very vulnerable in trauma of the lower part of the chest when a fractured rib can perforate the soft tissue of the spleen. Because it's so vascular and has, as I was telling you, it's a intermediate kind of a warehouse and storage place for red blood cells also, the spleen has a purplish color. It's in a way flattened, and in terms of size will be 5 to 6 inches long by 2-3 wide. On the outside is the spleen structure will have a capsule that is elastic and that allows that elasticity allows the spleen, the capsule, to contract and push on the spleen tissue to eliminate outside the red blood cells when needed. This contraction is the result of an involuntary muscle. So, along with with its function of filtering, the spleen also destroys old and worn out red blood cells, and will be a place where, by destroying those cells, iron and byproducts of hemoglobin will be manufactured, released, and will be sent to the liver. In the spleen, we also can produce some of the red blood cells, and that happens in the fetus before birth, and also is a reservoir, as I said, for blood that can be returned when needed. We can remove spleen. The procedure is called a splenectomy. Most of the time, our patients are doing well. However, because it's a large lymphoid organ, and we need its function as a lymphoid organ, the patients that underwent a splenectomy may require a special type of immunization or vaccination schedule in order to protect them, because they are considered to have a lower than normal response to pathogens from the outside, and also they may need to have prophylactic antibiotics administered whenever they have procedures like dental procedures or other procedures that may expose them to infection. Thymus. Another lymphoid tissue is located in the superior thorax, behind the sternum, and is very well developed during the fetal life and infancy. Will start to decrease, and in some people may almost completely disappear, while in other may stay present as lymphoid tissue. Certain lymphocytes that are called T cells, and they are called T because they have an affinity, they like the thymus. Those T cells will mature in the thymus gland before they are able to perform their functions. As a general rule, when we completely remove the thymus, in some conditions we need to, there will be a decrease in the production of T cells. And along with that will be a decrease in the size of the spleen and of some of the lymphatic nodes throughout the body. MALT, or mucosal-associated lymphoid tissue. In some parts of our digestive, respiratory, and urogenital tracts, we'll have areas where lymphoid tissue will be present in kind of islands and will help destroying foreign contaminants. And it makes sense when you're listening what systems I'm talking about. So I'm saying digestive, respiratory, and urogenital tracts. All those systems, they are connected to the outside world. So from the outside environment, we can ingest or inhale or absorb pathogens. This MALT tissue, mucosa-associated lymphoid tissue, contains leukocytes that have a high capacity for phagocytosis. And also, they may produce antibodies that can fight infection. We found this type of tissue in what is called the Peyer's patches. Those are clusters of lymphoid nodules in the mucous membranes, especially in the distal small intestine. We have similar type of tissue in the appendix and also at the level of the tonsils. We call GALT the tissue that is gut-associated lymphoid tissue. That's the tissue that I just mentioned before, Peyer patches, appendix, and tonsils. However, in the next slide, we will discuss tonsils as part of the lymphoid tissue. Now let's discuss this a little bit. The tonsils are some unencapsulated, so they do not have a capsule, masses of GALT, gut-associated lymphoid tissue. and they are located in the vicinity of the pharynx, in the throat, kind of surrounding the main gate through which our body may encounter pathogens. The tissue will have deep grooves, and those grooves will be lined with lymphatic nodules. In those lymphatic nodules, we have a high population of lymphocytes that are trapped inside those grooves, and they respond immediately to any pathogen. Let's see how many we have. So look at first of all, at the image A, named A. So you see that we have behind the soft palate, on the pharynx, we have the palatine tonsils, and those are oval bodies. And usually those are the tonsils that everyone knows that we have them, and they can become inflamed. We have a pharyngeal tonsil, also commonly named as adenoid. And it's called adenoid because it will have this kind of gland-like aspect, and it is located posterior to the nose. In your A picture, try and look where it says pharyngeal tonsil, very up where the sphenoid bone is. You will see a cluster of tissue. It's kind of behind the nose. You see that by the position, because it's located like that, whenever it becomes inflamed, and it's kind of a guarding tissue for the nasal cavity. By enlargement, you can imagine how they can obstruct the nose, and they can produce sleep apnea in children when they are very inflamed. And the last type of tonsil that we have is called the lingual one, and those are the little mounds of lymphoid tissue that are located posterior to our tongue, in the back of the tongue, pretty much the base of it. And you can see by having those three very strategically positioned areas of lymphoid tissue, they make out a ring, a circle around those areas that can have pathogen invading our body. We can remove them. Usually the lingual tonsils will not gonna cause problems. Those that are causing problems will be the palatine and the pharyngeal ones. When we are removing the palatine tonsils, the procedure is called tonsillectomy. Whenever you hear the word ectomy or the ending ectomy, it means a removal of some kind of organ. Or we can do an adenoidectomy when we are taking the pharyngeal tonsil out. However, most of the time those will be performed together. Also, most of the time we are not performing surgery when there is an acute infection. We let the infection go away, and we'll perform, if needed, the procedure on a later time. Question number 2. Lymph from the arm and breast passes through which of the following? A. Inguinal nodes, cervical nodes, axillary nodes, or tracheobronchial nodes. Axillary nodes are those nodes that will drain the lymph from the arm and the breast. Disorders of the lymphatic system will include infections, edema, and tumors associated with the system. We'll start by discussing the inflammation processes, not necessarily all itis, all inflammations of the lymphatic systems will be infections. The first condition that we describe is called lymphadenopathy. That means pathy, the suffix pathy means condition or disorder. So if we want to translate this word lymphadenopathy, we can say that it's a disease of the lymph nodes, and we use it whenever we'll diagnose an enlargement of the lymph nodes, whenever they are easily palpable, they are present, and they are sometimes sensitive to touch. That will be lymphadenopathy. We can have it as a generalized condition or localized. Most of the cases, the nodes will be tender to touch, and in some cases, they may just be enlarged. As a result of most of the time, the lymphadenopathy is the result of an inflammation/infections. However, the lymph nodes can be affected and enlarged as a result of a cancer process in the vicinity of that lymph node. The most common causes for lymphadenopathy, we have infections with HIV, human immunodeficiency virus, that in late stages, the condition is called acquired immunodeficiency syndrome when it exhibits more signs and symptoms of the condition. Another type of inflammation is called lymphadenitis. Itis, again, means inflammation. So this is the inflammation of the lymph nodes where the nodes will become enlarged and tender, and they may be associated with the signs of inflammation that will be the local heat and the redness around the same area. Usually it's a result of the body trying to overcome an infection. Usually lymphadenitis is localized. We see cervical lymphadenitis in typical upper respiratory type of infection. We can see it also in strep throat, in measles, in conditions as scarlet fever or diphtheria. Whenever the condition is chronic, we see that in infectious diseases that can have a chronic type of exhibit like tuberculosis. When we see axillary lymph nodes that are inflamed, that's the result of an infection in the upper extremities. For inguinal lymph nodes, lymphadenitis, that's a result of an infection at the level of the external genital organs or in the lower extremity. Lymphangitis is an inflammation of the lymphatic vessels, and you can see in picture A an example of that. Usually the infection is distal to the place of the location of the lymphangitis. In this case that you see in A, we can think that the infection is at the level of the wrist. If you really enlarge a little bit the image, you can see that it's at the level of the medial side of the wrist. There is an infection that's a lesion over there. So the infection will inflame and infect the entire tract, the trajectory of the lymphatic vessels, and will be also present at the level of the lymphatic nodes that are draining that area. Lymphedema is tissue swelling due to an excess of fluid. It can have a variety of causes, but most of the time we can say that all of them will have the same common denominator. The common denominator is the obstruction of the lymph flow. And there are several causes for that. It can be as a result of an infectious obstruction of the lymphatic vessel or a malignant growth that will produce an obstruction of the lymph flow, or a complete loss of that lymphatic vessel that we see when we perform surgery or when there is an injury due to radiation. We have some areas that will be more common. We'll see lymphedema. You see in picture B a typical example of lymphedema. You see that one arm, the right arm of the patient, is really increased in size and is disproportionate to the left side. And left side looks like a normal hand and forearm and arm, like while the right side seems very, very full of edema. And it's a typical picture of someone that had breast surgery for cancer, followed by a full axillary lymph node dissection where the lymph nodes in the axillary region were completely removed. Another type of lymphedema we'll see in what is called filariasis. And in this kind of filariasis, in this condition, what another name for it is elephantiasis. There is an enlargement of the lower extremity resulting from a blockage of the lymphatic vessels. And if you remember when we discussed conditions related to diseases of, conditions related to pathogens in chapter 5, we had a picture over there of a gentleman that had one leg that was extremely big as a result of a parasite that will colonize and obstruct um, the lymphatic vessels. Splenomegaly, whenever you see the suffix megaly, megaly means enlargement. Whatever comes before it is the organ that will be enlarged. Splenomegaly, it's an enlargement of the spleen, associated most of the time with acute infectious diseases. The most common cause for that would be the infectious mononucleosis, but also we can see it in typhoid fever, in typhus fever, or syphilis. There are some tropical parasites that may cause also splenomegaly. For example, a blood fluke, a flatworm that is common in some parts of Asia. Other causes for splenomegaly may be some pathological, metabolic, and physiological processes that are going wrong. And splenomegaly can be the result of a malfunctioning of the liver, may be seen in certain blood cancers as leukemia or lymphoma, in metabolic disorders, and sometimes we can see even hypertension in the splenic or hepatic vein. Special type of condition that relates to the lymphatic system are lymphomas. And lymphomas are, per definition, a cancer of the white blood cells. And usually they will affect cells that are B or T. We didn't do the immunity yet. Immunity will be the next chapter, but those two cells are the cells that will mature in the periphery and will be the cells producing the antibodies. There are two types of lymphomas. We have the Hodgkin and non-Hodgkin lymphomas. The Hodgkin lymphoma involves the B cells in the lymph nodes. The incidence of this disease is higher in a younger population, around 20 years of age. After that, there is a complete decrease of incidence. Will not going to show up until very late. So the ages when a patient may develop Hodgkin lymphoma may be either when they are very young or when they are older, over 65. The real cause of the condition is unknown. We believe that it may be involved a viral infection that hyperstimulates the lymphatic system and will cause one of the cells to go rogue and start becoming a cancerous cell. In terms of clinical manifestation, the disease presents as a painless enlargement of a lymph node or sometimes a group of nodes, and often they are seen in the neck or in areas that are easy to identify. Will be in the neck, in the axilla, or the inguinal area. This condition usually becomes quickly systemic, and without the treatment, it may make it go out of control and involve other systems. Pretty much like any other cancer, the Hodgkin lymphoma will have signs of weight loss, fever, night sweats, fatigue, and anemia, with a pronounced decline in the immune system. The patients will have recurrent and severe infections. In terms of diagnosis, what is pathognomonic, and the term pathognomonic means that is puts the diagnosis for a condition, will be the presence of Reed-Sternberg cells when we do a lymph node biopsy, and you see them that they look like an owl, like the cells and the nucleus. They look like they make a picture of an owl head. The treatment will be with chemo and radiotherapy. Those can come together subsequently or in any combinations. The results are usually good. Up to 90% of the patients that have an incipient disease as localized to a primary site or only in the regional lymph nodes have a high rate of survival for 5 years, up to 75. The second type of lymphoma is the non-Hodgkin lymphoma, way more common than the previous one. It's more common in older adults, in those patients that have a deficient immune system, like in patients with AIDS. In terms of clinical signs, we'll observe an enlargement of the lymph nodes. So we have lymphadenopathy, especially in the cervical region. And it usually spreads quicker than the Hodgkin disease to other tissues and especially to the liver. In terms of symptoms, both of the lymphomas share the same type of early signs as weight loss, and fever and night sweats. The difference is in diagnosis. If in Hodgkin lymphoma we'll have the red Sternberg cells, those will not going to be seen in a biopsy when we are having a patient that has non-Hodgkin lymphoma. Treatment again is just the same, will be chemo and radiotherapy in different types of combination, with also a good rate of success and remission from the disease. Question number 3. What is Hodgkin lymphoma? A benign tumor of the lymph nodes. B, a malignant tumor of the lymph nodes. C, a benign tumor of the spleen. Or D, a malignant tumor of the spleen. Hodgkin lymphoma is a malignant tumor of the lymph nodes.